Welcome to the Pain, Performance, and Pohada podcast. I am your host, Dr. Nick Smith. I'm a licensed physical therapist and strength and conditioning coach for Jiu Jitsu and other combat athletes. Today's topic of discussion is one that was recommended by a lot of different people on Instagram, and it's to describe what is the difference between insurance-based physical therapy versus what would be considered cash pay or concierge or more of a specialty type of physical therapy. Now, physical therapy can come in a lot of different realms. Physical therapists can participate in a lot of different niches, whether it comes to orthopedics. This is the most broad. Orthopedics is anything that's a musculoskeletal injury. Most of the time, orthopedic injuries would involve anything from, say post-operative, or if you had surgery on your knee, your shoulder, you would go see an orthopedic physical therapist. It can be seen in a lot of different avenues. Most of the time, it's a private pay type of outpatient clinic. In this, you go to your clinic, you'd have a physical therapist there. You'd be seen for that. That's what the majority of injuries that occur are musculoskeletal. Depending on if you're in another group here in California, there's a big hospital group called Kaiser Permanente. Kaiser Permanente also offers outpatient orthopedic physical therapy. Other types of injuries would be like neurologist or neurospecialist, physical therapist would deal with anything that involves the brain or the spine. This can involve traumatic brain injuries. This could be stroke. This could be spinal cord injury, multiple sclerosis. That's another avenue of physical therapy. And then you have things like pediatrics. They work exclusively with kids. You have geriatric, working with primarily older folks. You have skilled nursing facilities. So there's a lot of different ways that you can go to physical therapy depending on the needs of that particular, whatever your diagnosis might be. Now, the big difference, in at least here in the United States, you have insurance, right? The way insurance works is you pay a certain amount per month, and that gives you certain access to certain types of healthcare. Oftentimes, this is met with some kind of deductible. So even though you are paying an insurance premium to these particular insurances, on top of that, usually what's involved is you still have to pay out of pocket cash to meet a certain deductible in order for you to access those benefits. So in some cases, maybe your insurance is a little bit more affordable per month, but then your deductible is like, 5 grand. So even if you end up going through insurance, you still end up having to pay out of pocket up to $5,000 before those things are met. So if it comes to something like physical therapy, oftentimes, especially if it's non-surgical, it's really not that much cheaper. And the other part of insurance that is often overlooked is that you may not have access to the doctors, the physical therapists, or anything that you actually want. So maybe there's a physical therapy clinic that's in town. They do take insurance. Maybe they are a little bit more based towards your needs. If you're an athlete, you're trying to work with, a sports performance therapist, you might be able to see them because they're local, only to find out that your insurance is like, no, you can't do that. You can't go to this person because they're not in network. And if they're not in network, you end up paying out of pocket anyway. So let's say, hypothetically, you find an approved physical therapist that's in network, can be seen by your insurance. You get in there, then, only then, your insurance still dictates how many visits you get. So you might have a pretty involved surgery. You might have something that's been lingering for 6 months, maybe a year, and you're only allotted X number of visits for that year. Your doctor may have prescribed more visits, but your insurance is like, no, you get this many visits. I don't care what you say. Although we have no background in medicine, we get to determine your care. And this poses a lot of different problems. There are a lot of times, say, for example, you have an ACL surgery. Research shows that in order for an ACL post op before they can return to sport safely at full speed, assuming they pass all of their tests, there's no limitations, anything at all, a minimum 9 months. You have a 9 month rehab process. If you go back to full contact before 9 months, you have a 7 times more likely chance of re-tearing and needing surgery once more. I can't even tell you the number of times that I have been in an outpatient clinic working as a physical therapist and see that a person gets ACL rehab for 3 months. 3 months. It's a third of the time. Yes, at 12 weeks, you should be pretty normal in terms of just like your activities of daily living. You can sit on a toilet, maybe get up some stairs, walk around the house. If you're really on it, um, you might be doing some low level, activity. Definitely in the gym, doing those things if you're with a really competent PT, but you're still end up being short. So the insurance, the big problem with that is it often dictates how much you do, how long you do it for. Even if you're in medical necessity for it, they basically think that returning to sport is not medically necessary. Medically necessary means you being able to like go to work, function as a human being. So in a lot of cases, that insurance base is going to kind of cap you at a certain point. Then let's get to the money side of it. As I kind of already mentioned before, if you're in a certain insurance plan, depending on how good it is, you are either going to be paying a higher premium or you're going to be paying a higher deductible. Higher premium means how much you're paying per month to get that certain level of coverage. Um, PPO is usually a higher premium. You might be paying hundreds, maybe even thousands, depending on the size of your family, to have a PPO insurance. Now, when it comes to if you are sick, let's say you do have some heart issues, if you need to go see, if you have specialists that you need to see for, if you're a woman for OBGYN, insurance is definitely good. I don't want you to say to not have insurance, but when it comes to physical therapy, it's often not that great. Only because a lot of the quality physical therapy that you need, if you are a grappler, like if you are listening to this, or if you are an athlete and you're looking for something more specialized, you have everything fighting against you. The other issue with that, and we'll talk a little bit more about money, is as we talked about the deductible. So, one of the clinics that I worked at, you would, let's say you come in, it's a fresh start of the year, your deductible is not met. You are paying the cash rate when you go to this physical therapy clinic. So, you go in there, you're like, hey, I'm supposed to be covered. I found a physical therapy place that's near me that can take my insurance. Sweet. Only to go in there to find out that your evaluation is basically the cash rate anyway. And then you pay the cash rate for every single visit you are doing up until the deductible is met. I've seen people spend thousands in a month because their doctor recommended twice a week for 8 weeks. And this person, met their deductible by the end of it, but they're paying so much just to get basic routine physical therapy. Now, flip side of this, because insurance companies are charging the patient, the client, so much, adversely to that, not only are you getting bad network, you don't have a large variety of different doctors you can see. The physical therapy side of it, if you own a business and you're going through insurance, reimbursement for each session that a person comes in is getting lower and lower each year. So what you end up finding is you go to these physical therapy clinics and it's a zoo inside. Physical therapies, therapists are seeing 3 to 4 patients an hour to offset that cost that it would be. So you start seeing what I call a mill. It's a puppy mill. You go in there and they try to maximize every single dime that they can, giving you stuff that is not even necessarily helpful to you. You go in there and they'll give you every modality under the sun. They'll give you a hot pack, they'll give you a cold pack, they'll do electrical stim, they'll do ultrasound, they'll do all this awesome stuff. You might be there for an hour, hour and a half, only to find out that your therapist worked with you for like 5, 10 minutes. Full disclosure, in order for a physical therapist to bill that they saw you, they only need to see you for 8 minutes. At 8 minutes, they can bill one unit of some hand-to-hand, one-on-one treatment where they can bill you out for the rest of the time. In those 8 minutes, they could be doing something as simple as just asking you some simple questions. They might do a simple assessment. They might even do some manual therapy, some simple range of motion, some mobilization, maybe some massage, but they only have to work with you for 8 minutes and they can bill 1 unit of time. Then you can still spend the rest of your time. You could be there, you're like, oh, they see me for a full hour, but not with the physical therapist. They'll pass you off to one of their aides, maybe an assistant who walks you through some exercises that are supposed to be for your specific case that physical therapist may not even show you. It might be just the aide who is a high schooler, maybe an undergrad, if you're lucky, somebody with their bachelor's degree. It's basically personal training at that point. They're counting your reps, maybe, because there's six other people on the floor that they're monitoring, not just you. They'll hand you a piece of equipment, make sure you're doing it right for a couple of repetitions, and then fuck off to the next thing. And you are one of many people in there. So there is this aspect of like, can I afford this? My insurance is supposed to cover this. Maybe you end up actually spending more and you're getting far less. And I would say 99 times out of 100, if you're a jiu-jitsu person or you do combat sports, the likelihood of you finding a physical therapist that is insurance based, that understands the sport, actually knows what it is that you're doing is next to none. And I know that because I know where the physical therapists are. Because all the ones that work with jiu-jitsu people, combat athletes, they're doing their own thing, similar to me. So not only that, you are set up for failure when it comes to insurance. I'm not saying don't have insurance. Insurance is great. There are some other options, and I want to talk about some of those. And then I also want to talk a little bit more about what it looks like to have a cash pay type of physical therapy. There's a couple different avenues depending on what's out there. So, in terms of cash pay, concierge, you might hear performance physical therapy or rehab coaching. There's a lot of different terms for it. It's mostly just marketing. You may have some where they have a brick and mortar gym, very similar to maybe what you've been to for physical therapy, but it's dedicated more towards you. Oftentimes, you go in there, one person, maybe multiples if there's more physical therapists on staff, if they have a little bit more of an established business. But oftentimes, you'll be there for an hour, hour and a half, and it's one on one with that physical therapist. They have a much smaller team. Their approach is much more refined, and you'll find that they're going to charge accordingly. It's going to be more of an elevated boutique price than say maybe like a personal training session, but it's still very affordable in a lot of cases. Depending on who you're talking to, an evaluation can be anywhere between like $150 to $200, sometimes even more, depending on who you're working with. And you'll find out that that price is not that much more expensive than if you were to have to pay the cash pay because your deductible is not met. And I know this because I worked at a clinic that charged $200 to get that really bullshit care. You'd see a physical therapist for maybe, I was fortunate to be at a place where I could see somebody for like 30 minutes. I will say that's not bad. That's about as good as it gets. But still, afterwards, you're not getting the care. You're not getting one on one. You're getting very limited exercises and the aide is working with multiple people. So with this concierge, you can see it that way. They go session by session. They might have a little bit better control of communicating with you between, and you're obviously paying a little bit more of a premium because you are getting one-on-one care in a lot of cases. And because of that, you're going to get better. If you are somebody who specializes in a sport and this physical therapist happens to work with that sport, they're familiar with sports, they're familiar with the sport that you're participating in, you're set up for success. If they are proficient in what they do, it's also going to take less time because they're not guessing. They're usually a lot higher quality and they're going to know exactly what it is that you need and you can be able to hit it off right off the bat. And you're oftentimes going to be with them for less period of time. So it might seem like more of an investment, but if you look at the long term of it, it's actually a lot more affordable. The other piece of this that I almost forgot, but I think it's really important, is if you're going through an insurance model, there's kind of this like pathway that is really, really clunky. In order for you to get approval for physical therapy, oftentimes you will need a doctor's referral. So let's say you get injured, right? You get injured, something happens to your knee. First process is they have to clear out to make sure you don't have a fracture. You know you didn't break your leg, right? You twisted your knee, you heard a pop, you're like, my leg's not broken, I can walk on it. But insurance doesn't care. You have to go through this process. So you go, maybe you go to urgent care, you get your x-ray, they clear you out, you're not fractured. Fucking crazy. I know, right? You knew. You could be a doctor at this point. You didn't get a fracture. They're like, okay, well, you need to schedule an appointment with your primary care. You're like, okay, I'm going to go to my primary care. My primary care has full disclosure, they usually have only a few months worth of orthopedic expertise. If that primary care physician is good, they will be like, hey, I don't see this as a fracture. This looks like it's some kind of soft tissue injury. I recommend sending you to physical therapy. Now, the time that it takes for you to schedule that PCP might be weeks. By the time you get to your PCP and they tell you to go to physical therapy to get another session in with physical therapy for your evaluation, might be another week, 2 weeks, might even more, depending on how busy they are. So by this time, you've already wasted 4 weeks waiting for your insurance to kick through to see what benefits you have and if everything's covered, if this physical therapy can actually take your insurance. You're waiting for 4 to 6 weeks. I hear this story time and time and time again. If you go to a concierge physical therapist and you don't go through insurance, you can go see them. And I can almost guarantee you that you will have a session with them within 2 weeks. No questions asked. Most of the time, it's sooner. If anybody reaches out to me, I can usually see them within the week. No problem. Sometimes within the next 48 hours in a lot of cases. Um, and that allows you to be more timely. Time is money. You got stuff to do. If you're into physical therapy quicker, your outcomes are going to be better. So if you get better or if you start earlier, you're going to heal quicker. You're going to be done quicker. So pay for dollar. Oftentimes, concierge physical therapy is actually cheaper. Going to see a specialist, it may seem like more of an upfront cost, but by the time you pay for your deductible and all these different things, you might be spending far more than if you had just directly found a physical therapist who works with your sport, got in, got out, bada boom, bada bing. There's a lot there. There's a lot to unpack. Um, Overall, like I've seen every single avenue of different various physical therapy. I've worked in pediatrics. I've worked in neuro. I've worked with spinal cord injury specialists. I've done outpatient ortho in a clinic that sees 4 patients an hour. I've seen it all. Um, the best outcomes are the ones with the people who get the most direct and efficient care. It's not to say that you won't find a great physical therapist that will help you out. A lot of injuries do get better on their own. But to save yourself the time and the heartache, if you are a grappler, if you're a combat athlete, or if you're listening to this and you do another sport, find a physical therapist who knows your sport. I played every sport under the sun. I've worked with the highest level athletes in every sport, NFL level, MLB, NBA, um, golf, motocross, you name it. I've worked with them at the highest level, played all those sports myself. Now I've taken all this information, I've kind of boiled it down into working with combat athletes. Jiu Jitsu is my baby. I love Jiu Jitsu so much. And I know exactly what is needed from a grappler. I know exactly what a grappler needs to be able to do on the mats. And everything that I do, every decision that I make is directed around making sure that they can do their sport to the fullest of their capabilities. I'm very confident in understanding different positions and being able to actually go to a provider who could tell you the difference between De La Hiva versus single leg X is pretty important. You go to your doctor and you're like, yeah, I was doing a knee cut. They're like, what the fuck's a knee cut? And being able to just like talk to somebody who knows what you're talking about, understand the different positions without having to show them a YouTube video and be able to walk through those things is going to make your process so much faster. So if you've been dancing around in the insurance model, maybe that's you, maybe you've had this very similar experience. And maybe you're looking for something a little bit different. You're looking for something like, hey, what Nick is talking about, man, it's like, yes, that's something that I need. If you ever need to be pointed in the right direction, maybe not even somebody to work with me directly, But if you need to be pointed in the right direction, somebody who could be like, hey, this is the person that will take care of you, whether it's me, somebody else, please, I want you to reach out to me. In the show notes, I want you to check out. You can always feel free to DM me on Instagram at SmithForgedSC. I'd love to be able to answer any questions that you have. And if there's any questions that pop up or arise, maybe with your particular situation based on what I talked about today with insurance, please reach out. I'd love to be able to discuss it with you and get you pointed in the right direction, get you back to your sport and participating at the top of your level. But it's the end of this episode. Thank you so much for listening in. We'll see you guys at the next episode of the Pain Performance Bojada podcast. See you.